Hey everyone, welcome to Taking the Pulse, a healthcare and life sciences video podcast. I am Heather Hoops Matthews here in the studio and joined remotely by Maynard Nexen healthcare attorney Matthew Roberts. Matthew, good to be with you.
Good to see you.
And we are honored today to have Senator Tom Davis join us. He has served as a state senator of South Carolina District 46 since being elected in the early 2000s. Senator Davis has championed efforts for medical cannabis legislation. Senator Davis, thank you so much for joining us today.
Great to be with you.
Can you start us off by talking about what got you interested in this topic of medical marijuana?
Sure. It was back in, 2004, maybe January. I'm sorry, not 2004. In 2014, January, I was speaking to a Rotary group in Beaufort and talking about education or some such thing. And then after my speech, a woman came up to me and said, have you ever thought about legalizing marijuana for medical purposes? And that was the first time I had ever thought about marijuana in a medicinal context. I never really, made that, particular connection. But I told her I would look into it after she told me that she had a granddaughter who at that time, I believe was 5 or 6 years old. Her name was Mary Louise, who had epilepsy, intractable epilepsy, which I learned was epilepsy for which pharmaceuticals or drugs really don't abate the seizures. And she suffered up to 60 to 70 seizures an hour. I mean, it was really pretty dramatic to the point where she couldn't get out of a wheelchair because she would fall down. And so I looked into it and I found out that sure enough, there was a lot of empirical research for the proposition that the cannabinoids in marijuana interacted with the cannabinoids in someone's body to address neurological disorders like epilepsy. And so based on that, I filed legislation in 2014 that legalized or authorized physicians to let their epilepsy patients use cannabis to abate their seizures. And that passed and was signed into law by Governor Haley in 2014. And then in the course of doing that, I found out that there were other medicinal benefits for cannabis in terms of chronic pain management and other neurological disorders and things of that nature. And so ever since then, I have been pushing for a more expansive medical cannabis bill that would be very conservative. It would rely upon physicians to authorize its use. It would rely upon pharmacists to dispense it to patients. Only certain conditions for which there is empirical evidence that marijuana can be beneficial would be qualifying conditions for the use of cannabis. So that got me interested in it. We have 39 other states now that have legalized cannabis for medicinal purposes. We came close a couple of years ago in South Carolina. It passed the Senate 28-16, but it failed in the House. But I do think that next year will be the year we get it over the top.
Senator, you've been the primary leader for this, and you've relied on the evidence, you relied on the data to support it. And you did run into, you had great success 2 years ago, and it failed in the House and over, I guess, a technical issue in theory from their perspective.
Yeah.
But you refiled, you've got a new modified version of your Compassionate Care Act. Tell us about the current proposal and describe the medical conditions that will be eligible for the use of clinical cannabis.
Yeah, I mean, the version that has been filed now is materially the same as the one that passed the Senate a couple of years ago by that 28-16 vote I mentioned. The one change is there is no tax referenced in this bill at all. That was where it ran into problems over in the House. There's a provision in the state constitution that says any bill that is a revenue-raising bill must originate in the House of Representatives. My argument was this wasn't a revenue-raising bill and that it wasn't raising money for the general fund. It was going to be subjecting to a sales tax that would help mitigate the cost of administering the program. Nonetheless, until the here nor there, we refiled it without that reference to a tax. The qualifying conditions, there are roughly 10 or 11 of them. And again, they're only conditions for which there are peer-reviewed studies in other states that demonstrate a definite positive correlation between the use of cannabis and the mitigation or the medicinal effects on these conditions. And so it's not like other states, which is very open-ended. I wanted our bill to be very conservative, to be based on science, the conditions for which cannabis can be authorized by physicians. I wanted there to be demonstrable, peer-reviewed evidence that there is a direct correlation between the use of cannabis and addressing the medical conditions. So, I mean, this particular bill, I promised my colleagues, would be purely a medical bill, very conservative, tightly regulated. It wouldn't be the proverbial camel's nose under the tent that would lead to recreational use. And so one of the things that we've benefited from is that we have had 39 states that have legalized, cannabis for medical purposes now. And we can look at what's worked in other states. We can look at what concerns other states have encountered, what have been some of the, unintended consequences. And so this bill has been refined over time to take into account all of those things. And so I'm not bitter or frustrated over the fact that it's taken a long time to get this legislation passed. The process is working the way it's supposed to. I mean, you're supposed to answer questions and objections when they're interposed. And as a result of opposition, so to speak, it's become a better bill. It's forced me to be more precise in with language and more specific in terms of how it works. So I feel very comfortable and very confident in this work product. I know my colleagues in the Senate do. They demonstrated that by approving it 28-16 a couple of years ago. And truth be told, if it gets to a vote on the floor of the House, it's going to pass there as well.
Yeah, I was going to ask you that.
So again, I'm very optimistic about next January in 2024.
So you still think you have the support in the House that you did last time, but didn't get a vote?
I do, but there's a difference between saying, on the one hand, that if it comes up for a vote in the House, it will pass, and actually getting it passed. Because, there's going to be a member up there, for instance, who's already said he's going to put over 1,000 amendments up on the desk in an attempt to derail consideration of the bill. And what it's going to take is political resolve on the part of leadership in the House to say, we're going to sit down here and we're going to work our way through these amendments and we're going to get to a vote on this bill. And until that commitment is made, and until that sort of like it's demonstrated that, look, we're going to go ahead and sit here and be here for as long as it takes to get it done. I mean, that's what it's going to take in order for it to finally be brought up for a vote. And I feel confident that the House of Representatives, under the leadership of Speaker Merle Smith, I do think there's a political resolve to get this to a vote.
Senator, in following the news and just reading about this over the last couple of years, I've seen where law enforcement has been opposed to this idea of a legalization program, calling cannabis or medical marijuana a gateway drug. What do you think of that position, and what, if any, are there other hurdles that you may need to overcome?
Yeah, I mean, and look, let me first state that, SLED has been a vigorous opponent of this bill. I will say that I have great respect for SLED Chief Mark Keel. He came up through the ranks in narcotics, and he has a certain perspective in regard to marijuana and experience with marijuana and his potential abuse that I don't share. So, I respect him and I respect his position. And his challenging of this bill and looking at the language has forced it and caused it to become a better bill. It's made me do my job better, to sit down and be more precise. But in regard to the specific concerns that are raised, for instance, saying that it's a gateway drug, or saying that it gives rise to more accidents on the highways, or saying any number of things, we can look at the experiences in the states that have had medical cannabis programs, in some cases for decades. And we can look at empirical studies and we can disprove these concerns. We can show how they're not founded in reality. And so that's what I attempted to do successfully when I got it past the Senate a couple of years ago, is every time a concern like that was raised, I would go to the studies that had been done in these states, again, empirical studies based on years worth of data, and was able to show how these fears were unfounded. And so I appreciate the fact that there are concerns out there. I welcome the opportunity to take them on and talk about them and show, why those concerns are unfounded. But I do want to emphasize they're coming from a position of good faith. I mean, they have certain strongly held beliefs. And politics is all about persuasion. It's all about making your case. It's all about presenting the evidence. And so I don't resent having to do that. That's my job to do that, just like he has a job of presenting the facts that he thinks I need to consider.
If your bill is passed, how would the legislation regulate the dispensing of medical cannabis? Would it limit the number of provider permits like other states have done? How would that work?
Yeah, it's constrained in each respect. I mean, there's so-called medical cannabis establishments. You have grow facilities that would actually grow the marijuana or cannabis. You have processing facilities that would take that cannabis and process it into a consumable or digestible product. And then you would have these dispensaries or pharmacies that would actually dispense the cannabis to patients who were authorized to access it. In each instance, in regard to the growers, the processors, and the dispensers, there's a certain limited number of licenses that are available. It's not open-ended. And that's for a couple of reasons. One, we wanted to start slow and start with a program that was easily regulated by DHEC. We didn't want to have it so broad to where they weren't going to be able to get their arms wrapped around what was going on out there in the cannabis space. And so I think by limiting the number of licenses, we do make it something that is easily regulated or can be regulated in a way to ensure safety for patients. And so, but the way we have it in South Carolina, again, this was a very conservative bill. Unlike other states, we require in my bill that it be pharmacists that dispense the cannabis to patients. And that's important because when a patient gets an authorization and then goes to a dispensary for the cannabis, having a medical professional there that can counsel them and talk with them about, well, what are your problems? Is it chronic pain? Do you have a neurological disorder? Are you having a hard time sleeping? Do you have anxiety? And the pharmacist can provide guidance in regard to what type of cannabis product would be most suitable for that patient. Because, you know, the ratio of THC and CBD is important. And those are the two primary chemicals in the cannabis we're talking about, THC and CBD. THC being with the psychoactive components, CBD does not have psychoactive components. But again, these cannabinoids interact with the body in certain ways. And so depending upon what your particular medical condition is, you may want something that is high in THC and relatively low in CBD, or conversely, your medical condition may suggest you want the converse. You may want something that's high in CBD and low in THC. And so having a medical professional like a pharmacist at that dispensing level provides that measure of assurance that the right medical product is going to be put into that patient's hands.
And from an optical perspective, we're talking about pills and liquids, no cigarettes, no smoking. I mean, just to clear that up, because there's been some misinformation about that.
Yeah, and that was, you know, a couple 3 years ago when I was sitting down with Chief Keel and I was trying to identify, you know, I understood they opposed the bill, but I said, what are your primary concerns? What are your, if you had, you know, ability to amend this bill to make it more acceptable to you, what would it be? And he said, well, the number one concern we would have is it being able to be consumed through smoking, through burning the flower. Because he said, in that way, it's indistinguishable from individuals who are smoking marijuana for recreational purposes. And so if they saw somebody that was smoking a joint or burning flower, inhaling it in that way, smoking it, they wouldn't be able to quantitatively determine whether or not this was for medical or recreational. And so I said, okay, we'll move to other modes of consumption. We'll delete out, you know, burning a flower or smoking. That way you won't have that ambiguity out there in public, and whether or not somebody's, you know, consuming it legally or illegally. So that's the whole reason behind excluding smoking from this bill, was an accommodation to law enforcement.
Senator, next year, 2024, that you feel confident about is an election year. And in covering the State House for many years, I could see sometimes where that would have an impact on the progress of legislation, sometimes making it more difficult to pass significant legislation. Do you foresee that as a hurdle, not just for your Compassionate Care Act, but maybe for other healthcare related pieces of legislation next year?
Yeah, that's sort of the conventional wisdom, but I would actually make the counter argument. I mean, poll after poll, without exception, over the last 7-8 years has indicated about 75% of South Carolinians believe that marijuana ought to be made available to patients for medical purposes, subject to physicians' oversight. So this is an issue where the people of South Carolina are way ahead of the politicians. So this notion that somehow supporting medical cannabis is going to make you vulnerable at the polls, I would argue the converse is true, that if you continue to deny medical science, if you don't, you know, pay attention to the National Academy of Sciences, which has done over 10,000 scientific abstracts and said there's conclusive proof that marijuana or cannabis can have medicinal benefits, and they directly lead to less reliance upon opioids or opiates. If you go ahead and you deny access to this, you deny access to something that can work and provide relief in a much less intrusive or dangerous way than opioids do, you may make yourself politically vulnerable out there. And so I understand the conventional argument that we don't want to take this sensitive issue up in an election year. But again, I mean, the poll data is overwhelmingly clear that South Carolinians want this to be legalized subject to a doctor's supervision.
Let me ask you a question about that, because the polls are important, and you're right about the support for medical cannabis. But why do some politicians seem to ignore that and pursue their own political objectives? We know that the voters matter, but the polling to the voting populace doesn't always transcend to actual policy. Why do you think that is?
I think that's true, but I think in large measure, the reason you've got a 28-16 vote in the Senate, and the reason why if it came to a vote in the House, it would pass, is because a lot of the politicians and elected representatives have seen those polls, and they do understand where the people are. Those that oppose it, I think, are those that are listening to law enforcement, and all the sheriffs around the state. They have relationships with the sled chief, and so they don't want to go against what the sled chief has to say. And, look, law enforcement's an extremely respected members of the community, as they should be. They carry a lot of political clout, a lot of sway. I mean, they're highly respected. And so having them opposed to something like this does give elected officials some pause. Okay. I mean, and rightfully so. Anytime a respected member of the community like that is speaking against something, I think you've got to take them seriously and listen. But again, I think the facts are so overwhelming now in terms of medicinal benefits, and the facts in regard to where the people of South Carolina are on this issue, I think, are sufficient to overcome that reluctance.
Senator, we've got a couple of minutes left. If you don't mind, I'm going to ask you a somewhat off-topic question. Last year, or this year, I suppose, in the South Carolina legislature, eliminated, for the most part, the Certificate of Need program impacting the hospital system, healthcare industry. What do you think, looking forward, that impact may have on the industry here in South Carolina?
Yeah, I think you can look at the 12 other states that have repealed their CON laws, and you can see what the practical effects of that have been. And it's been to have hundreds of millions of dollars in private capital flowing into a state and developing healthcare facilities like ambulatory surgery centers and non-traditional means of providing healthcare access. And that's a good thing. I mean, anytime you've got competition in the provider space, anytime you provide patients with options, I mean, that market dynamic, with more providers having to compete for the business and patients having more choices, you're going to end up with a better product, better access at a lower cost. And so, again, in theory, that sounds true, but also we can look and see in reality what's happened in states that have repealed their CON laws, and we can see empirically that's true as well. So in this case, with the repeal of CON, common sense tells you that if you don't constrain supply, you increase access. But we can also look empirically at what the experience has been in other states that have repealed the CON laws. I think we're going to see a lot of more access in rural communities. We're going to see affordability increase as competition increases. But we're going to look at it very carefully to make sure that our assumptions in this regard are correct. Because as lawmakers, you do the best you can based on the empirical data that's out there and based on what you think is good public policy. But you always look at what the practical effect has been. And you always have the willingness to make adjustments if what results turns out to be something you didn't anticipate. And so I'll be watching very closely, as will my colleagues, over the next couple of years to see exactly what has been the impact of repealing CON.
Well, Senator Tom Davis, you have graced us with an abundance of time this afternoon. On behalf of Matthew Roberts, our whole Taking the Pulse Healthcare and Life Sciences video podcast team, thank you for that. We appreciate your service in general to our state. I encourage you to press on and look forward to, hopefully, once the session gets back in January, you'd possibly consider coming back on and telling us the latest with your Compassionate Care Act, giving us an update on that. Would that be okay?
Absolutely. I'd welcome that opportunity and appreciate you having me.
Okay, thank you so much. For those of you who joined us today for this edition of Taking the Pulse, we hope you learned something more about the Compassionate Care Act and medical cannabis. We look forward to discussing topics like this in the coming weeks, and we hope you join us again right here on Taking the Pulse, a healthcare and life sciences video podcast.